for inviting me to this distinguished panel. Let me say first, besides the technicians over there, I'm probably the only person in this room who is not a health expert, but who tells you about why health is becoming more and more important for G20 leaders and for global governments, because international coordination in the health agenda is becoming more and more important. 2018 marks the 20th anniversary of the G20. 10 years ago, in 28, after the worst financial crisis, at least in the Western world, but the consequences have been felt here and elsewhere in the emerging world also. It was decided to design the G20 as premier forum for global economic governance. It was first a crisis mechanism to deal with the financial crisis, was very successful in dealing with the immediate consequences of the crisis. But since then it has become more and more a forum which also addresses long-term challenges for the global economic agenda. And in this case, its role in dealing with the global health agenda is a case in point. If I had to address or choose 3 key issues which made health an issue for the G20, I would probably say it was the Ebola outbreak in 2014. It's the growing antimicrobial resistance, and it's the health agenda on universal health coverage and in the SDGs. We'll speak very briefly about these 3 issues as an impulse for our discussion later on. So 2014 saw a shift in the global health for the G20. G20 leaders met in Antalya in Brisbane at a time when the world was racing to contain the Ebola outbreak in West Africa. The number of cases doubling every 15 to 20 days. The worst case projection said we would have 1.4 million infected cases, and so this would have been would have had apocalyptic consequences for the world. There was a decisive joint action led by the World Bank, the IMF, and G20 leaders, putting another $300 million in the fight against Ebola, doing more on awareness, really coordinated action of the world community. And this has shown that it's really worthwhile to put this on highest level on the screen, because then you can have more decisive actions than with the existing architecture. And it has also shown that clearly in the current national architecture and the current international architecture, there are some gaps to bridge, and that's why the G20 has continued taken also the G20 summit in Antalya to pay more attention on coordinated actions on healthcare challenges. In addition to Ebola, it was the UK Prime Minister who urgently asked his colleagues to take actions on antimicrobial resistance, which is, as you know, the growing resistance in the case of the use of antibiotics and the oversubscription of antibiotics both in human diseases but also in the agriculture sector, so big issue. We have presented as the OECD, therefore, to the G20 leaders in Hangzhou in 2016, a report also on the economic consequences, that if we fail to tackle antimicrobial resistance, we may risk 10 million lives a year by 2050. We may lose a cumulative $100 trillion of economic output just because of this not dealing with the growing resistance. So in addition to preserving existing antimicrobial products, G20 underwent to look at ways to unlock research and development into new and existing antimicrobials. In essence, G20 leaders concluded that there needs to be an new economic model to reward innovation. Also, in the Chinese presidency, am I too long already? There was first time the consideration of the Sustainable Development Goals and the related recommendation. This was informed by a report chaired by the presidents of France and South Africa, with the heads of OECD, WHO, and ILO as vice chairs. was a report on health, employment, and economic growth. This landmark report shows that health is an investment, and it's not an economic burden. Around 1/4 of economic growth between 2000 and 2011 in low and middle income countries estimated to be stemming from improved economic health. The report also emphasized the important contribution of women in the health and social sectors, making up of 67% of employment. So another angle showing that health is first a human issue, but secondly a social issue, and third also an economic issue. I mean, this is one of the key messages I want to leave also as an input for this discussion. On this basis, the German presidency last year put for the first time health really at the center of G20 deliberations. There was the first G20 health ministerial meeting held in Germany. Focus was on AMR, but also on the emphasis on the importance of health system to strengthen if all countries are to achieve universal health coverage by 2030. We are also looking forward and welcome Argentina's decision to continue with the health ministerial the Germans started, focus on universal health coverage, antimicrobial resistance, and Argentina will add a third issue, which is the so-called non-communicable diseases, particularly obesity, because many of the causes are well known and because NCDs are accounting for half of all deaths. It's important, an important opportunity for health ministers to make the case for concerted whole of government action to tackle them. Many of the causes are well known. We are eating, we are drinking, we are smoking too much, and not exercising enough, as you can see in me. However, we think that the issue on this non-communicable diseases goes well beyond health ministers and the health community, which is in the room. It goes on controls on sales, fiscal incentives to change behavior, radical rethinking of urban planning, transport policies, to highlight just a few, sport policy. So there are a number of issues which are going beyond the responsibility of the health community in general. This is why the OECD is particularly happy that we can contribute to the international agenda as we work horizontally, bringing together experience in areas beyond health, including science and innovation, fiscal policies, labor market, education and social policy. And this is one of the second thing I want to leave the panels with, that we are not only discussing the healthcare impact, but also a broader context of the policy mix which is required to improve sustainable health. This brings me to my concluding remark. I really believe that besides what we are doing in national healthcare system, international coordination is very important, and international coordination goes beyond existing structures in the WHO. It includes the G20, it includes other bodies, and it also includes fora like here, where we discuss in an informal way some ideas of bringing the health system forward. Thanks a lot.
Thank you. Thank you, Andreas. Before we go to the interventions, let me start out by saying that India is increasingly putting greater focus and priority on health and health policy. In fact, in the last budget, the government announced a very significant increase in government spending on healthcare, with the aim that by 2025, India will spend 2.5% of the GDP on health. There is an increased effort to coordinate the efforts within the government across the different states. As you will appreciate, India is like a continent with states that have very specific problems of their own. In fact, national health policies have very few broad objectives. It's the disaggregated level at which we tend to struggle. So while there is an effort to coordinate our efforts across the states within the country, this is also another way to coordinate our efforts with the international community, because increasingly there is a sense that there are many aspects to health which are like global public goods. There are very serious externalities when it comes to healthcare that cross borders. And that recognition is leading to India spending more energy and resource towards these kind of efforts. It's for the first time that the G20 under his presidency actually put this kind of effort on healthcare. It wasn't traditionally the G20 was really about financial market stability. So given that G20 has put this enormous focus on healthcare, guided by, of course, the 2030 agenda, the specific areas that this body wants to focus on, which are very, very consistent with the efforts that the Indian government and state governments are also facing, are bacterial infections, resistance to antibiotics. For those of you in the room who have been following Indian public health, you do realize that this is a very grave concern. Particularly because we have unregulated prescriptions, pharmacies which are not very well regulated. So we have rampant prescriptions of antibiotics, and therefore the resistance and the superbug and so on and so forth. We have pandemic preparedness, that is another of the objectives. And again, with the kind of dengue outbreaks and Japanese encephalitis, we have localized outbreaks which are highly predictable in terms of the seasonality, and yet we are struggling in terms of containing them and minimizing the cost to the society. The resilience of the health systems, and this is one place where India is trying to come up with new experiments and innovations, because health is a state subject. Different states are experimenting with very different interventions as far as improving access to care is concerned. And governance of healthcare is one of the key concerns, because within India we have at the district level health regulated very differently in states like Kerala than they are in Uttar Pradesh, for instance. So you have highly empowered chief medical officers in southern part of the country, which is also one of the reasons why the outcomes, health outcomes are actually far better, because governance is structured differently and in better ways. And then access to healthcare. That is one of the focus areas for the G20 in health. Access to care, universal healthcare, these are focus that again the government is grappling with. We're trying to put a structure to what exactly should universal healthcare in India look like. And so this is happening at a very good time. Most of us in this room are to learn from the international experiences of our panelists. I now welcome Wolf Reiner, the head of Global Governance Programs at the German Development Institute. And Wolf is going to talk about, is there a need to revitalize global health leadership? It's a very small topic. Please take away.
Thank you very much. Thanks for joining us here today, this afternoon. I'm very honored to be part of this distinguished panel, and I'm also here to learn a lot. And I think I can take up some of the elements that have been mentioned just before. Basically, my question is, you talked about leadership. Is there a need for new leadership? And I will ask, is the G20 in the position to provide leadership? And when answering this question, I would like to start with the question, what is leadership? And I just come up with a very broad idea of leadership, which is if a leader should somehow facilitate the agreement and the achievement of common objectives of a joint group of states. So that states have the same understanding what global health issues are, and they jointly push forward to the solutions. And my question is the G20 good positioned to do that? What makes a good leader in global health is he or she or the country or the institution can deal with this very, very, and I should stress that, complex setup which is characterized in global health governance. And we mentioned that before. We have a strong interconnectedness of different policies. So it's not one health policy, but we have so many different policies that have health-related aspects which have to be addressed. We have interconnectedness of different political levels. So the things that happen on the ground have global implications. And then we have this plethora of actors dealing with health-related issues, and we have the private sector, we have foundations, we have the industry, research, civil society, humanitarian aid institutions. So, and we have all these actors, and it's very, very difficult to bring them all together. And one of the striking patterns as a political science perspective outside on the governance system is that these actors, from time to time, occasionally they join forces, but not always, join forces, and they can come from the full spectrum of actors and push forward. And we ask ourselves, when does that happen, and under what conditions can this happen? And we have good examples for that. The Ebola case was mentioned before, the Global Ebola Response Coalition, the Vaccine Alliance. We have many examples where it worked to move together. So the G20 is somehow, as we learned, the new star in this universe of actors, yet another actor. And Andreas asked the question, or said, maybe it can fill a gap in the current architecture. And I can skip the part on what the G20 has focused on recently, because we've heard that before, health systems, cross-border health issues, and also on an applied level, the G20 leaders had this simulation exercise on a pandemic outbreak. So very applied instruments, and the endorsement of the Agenda 2030 Sustainable Development Goals, which are actually an encompassing health agenda. So what's the role of the G20, and what's with the leadership? And I would like to remind everyone, and we've heard that also before, what the context of the creation of the G20 was. And was there as a financial crisis, saved the economy, and this is an organization that originally focused on economy and finances. So it still has these roots, I argue, and say what the G20 can do is it can provide political support for health initiatives. It is very good at agenda setting due to the composition. It can launch new initiatives, we have seen that, and build so-called high ambition coalitions of actors from that plethora of actors. And apparently it's even able to bring together this wide set of stakeholders. And we've seen that in the G20 process with the B20 and the C20 and the T20 engagement, all these platforms revolving around the G20, that the G20 actually can do that. It, in principle, can even work with this multi-level system, from the very top to the local implementation part. But it is, and this is my major point here, it is good at agreeing maybe on common objectives, and it can facilitate the implementation by providing funding, but it also has limitations. And this is my second major point here. The G20 and the G20 members, what they cannot do is provide universal expertise in the health field. They don't have the institutionalized setup which is needed. Actually, from a governance perspective, the G20 is very weakly institutionalized, and it cannot cover the full spectrum of health activities. So if we have that universal application, and health issues, global health is about transcending boundaries, it's a universal issue and not only that of 20 countries. So what my point is, G20 can facilitate the achievement of goals. It's good at creating common objectives, but it cannot implement them all by itself. And this is where other universal institutions come in, and I would say in particular the World Health Organization, which is in the reform process, as those who follow it know, for a long time, but also is being strengthened, at least with the health emergency program following the Ebola case. I don't know, am I running out of time? Probably. Yeah, I have a minute. So for the leadership definition, achieving and creating common objectives, we see a mixed pictures. And maybe now that the panel is called Framing the G20 Health Agenda, I would mention one other point. When we look in the history, when the global health governance moved, when did that happen? Usually that happened in a crisis context. And this crisis context often leads to the fact that a health issue is somehow securitized. It becomes a security issue. And this is, you look at the security conferences in Munich, referring to Ebola, that was on the same level as terrorism at that time. So and we see that securitization can move the system and bring the actors together. But many health aspects are not security issues in the normal framing. So that we cannot, if we talk about universal health care, it doesn't belong to this framing of a security issue. And here, now that we see that the G20 is with its economy roots, it can at least approach issues which have social determinants, which relate to the economic development of countries and the health-related aspects to that. And I think this is an important role for the G20 as well. I will leave it at that, and thanks for open to your question. Looking forward to it. Thanks.
Thank you, Wolf. Our next speaker is Dr. Elena Dimitrieva. She's the director of Russian NGO Health and Development Foundation, and she's going to speak about how can the G20 work together to ensure that the 2030 targets for NCDs are met. Now, for those of you unfamiliar, India has just discovered as of last month that our NCD incidence, actually 60% of our disease burden is now because of NCDs. And partly because our surveys are so low frequency, it has taken us 10 years to really discover that. And we'd like to hear what has Russia done and what are the G20 promises as far as tackling the NCD burden is concerned.
Thank you so much. I'm really honored to be invited to this event and speak to such a distinguished and unique audience. Of course, their priorities in health may vary from country to country, and we may put different topics on the agenda. Of course, the most important, and this shift has been quite noticeable, is a shift from the curative medicine to the prevention medicine. And we understand that it's more important to prevent diseases rather than look for some urgent means to combat with certain diseases. The most difficult question here to address is really the question that Andreas already has raised in his talk, how to change their behavior. And this is the most important, how to change individual behavior to reach the results in prevention of non-communicable diseases or infectious diseases. Actually, the clue will be the one is what is the effective communication and how to do this. We do understand that it's important to increase vaccination level. We do understand that it's important to decrease smoking prevalence in certain countries. We do understand that the prevalence of cardiovascular diseases and deaths from cardiovascular in some countries are extremely high and needed to be prevented. And all these diseases can be really curated by effective behavior change communication campaigns. Behavior change communication campaigns have been done all over the world using different means of communication. But in fact, what has been raised today during the lunch session, it's really important to combine innovations and public health, to bring them together and to do behavior change communication campaigns using innovation. There might be different answers. What do we mean by innovation here? But for instance, we have extremely wide usage of internet all over the world, and it's increasing over the time. We have very high rate of cell phone penetration in many countries, where we can easily use these means to change their behavior. This really not an easy task to be put either for the governments or for the whatever institution. And as Wolf said already, it's really the task to bring together different actors. So it's the partnership that should be set up between leading academic institutions, governments, non-governmental organizations that can bring together the expertise, and sometimes, like for instance, if we speak about company behavior change communication campaigns using modern means of communication, then we need to include, for instance, telecommunication companies. So it's really a big pool of factors that can affect their behavior and can affect it quite successfully. I would like to share one of the examples that really give the idea what this might be. I would like to speak about several programs, but to highlight one program that was aimed at improving health of mothers with newborns and pregnant women. So this program was called in Russia SMS Mommy, and that program has the name Text for Baby in the United States. And I would say this was the program that emerged from our extremely effective work with our colleagues from the United States back several years ago. So it started from text messaging, but emerged into the program that include all communication channels that are available, for instance, in the mobile phone. And if we have a woman registering in the digital platform through her cell phone to the program, then she's getting information via whatever she chooses, either messengers, Telegram, Viber, or WhatsApp, or she is getting messages through Instagram, or let's say text messages if she's living in the remote area and she doesn't have smartphone. But we have very good coverage of the entire population, and through this coverage we can give women all the messages that we consider are important. So this program was developed in the partnership with the Ministry of Health. And what is more important, I would say digital platform is important to be developed, and it's really a big piece. But it's also the model of content development that is critical, and that it will be balanced between medical knowledge and psychological support that client is needed. So this content is critical, and this is the success of the program is in content. The program has been run by our NGO for 5 years. It's became federal program, and since communication is worldwide available, so we have subscribers for our program in the United States, Kazakhstan, Ukraine. So whenever we speak about Russian-speaking community, so those who pick Russian as a language, then they get this information. It's extremely effective in Russia, and for instance, along with all the changes to the healthcare system in maternal and child health, it affects all the indicators. For instance, as it is stated for December 2017 in Russia, we have 5.3 infant mortality cases per 1,000. So it's gradually decreasing, so we increase the information flow to the clients. We also apply the same approach to cardiovascular diseases prevention, and we are applying this approach right now to those who would like to quit smoking. That is really a very serious problem. In Russia, we have high prevalence of people smoking. That is contribute to the heart diseases rates in Russia as well. So when we speak about what we do, we probably need to address also the question how we do. And if we will leverage the best practices of using mobile health interventions in resolving of non-communicable diseases, then along with the effective leadership and right topics brought on the agenda, we will have very effective programs that will achieve results. And this finishing, I would like to say that this is really very important when we have health diplomacy as a kind of the door open regardless of all the difficulties we have in the relationships, because we really want our beloved one to live. We do want our relatives to live as long as possible. We don't want our relatives to die from either cancer disease or heart attacks. So I think that it's very important for us to develop health agenda and to see how we can do programs as effective as possible. Thank you.
Thank you, Elena. Now, moving from maternal health to women's health, and we often tend to mistake the two to be the same. In fact, in India, a large part of women's health is concentrated around reproductive health, and that is a concern. So to talk about how can cross-cutting issues of gender be effectively integrated into the G20 health discussions, and how can the G20 incentivize governments to explore intersectoral convergence at policy level to address gender equity, we have Dr. Preetha Rajaraman from the US Embassy. She's a health attache for India and the regional representative for South Asia, Department of Health and Human Services.
Here we go. So thank you so much for the invitation to be part of this truly vibrant forum. I thoroughly enjoyed listening to all of the other speakers and look forward to the discussion. So certainly, you know, we've heard that health is not only central to our well-being, but also to economic development and global security. And given that the leaders at G20 have firmly put health on the agenda, it's really up to us to carefully consider what shape this could take. And one part of that is the important question of how can gender be included in these discussions? As many of you know, the UN Sustainable Development Goal 3 aims to ensure healthy lives and promote well-being to all at all ages. And this includes reducing maternal and infant mortality. And the fifth SDG aims to achieve gender equality. So how do you put those two together? Well, first of all, we need to realize this is part of a larger cycle, which is something that Shamika sort of said. You know, we focus on saving the child, including the girl child, but that child then goes on to become that same mother who is at risk for death in childbirth. Perhaps she survives that, but then she goes on to perhaps face death from breast cancer, cervical cancer, heart diseases, other chronic diseases. And isn't that 50-year-old woman that's facing these health issues as precious as the newborn whose life we tried so hard to save? Why are these two different issues? They're all part of the same issue. And in fact, how about these women in all of their productive years? Shouldn't we be empowering them there as well? So it's really a larger issue. We know, for example, that India alone loses more than 2 million children under the age of 5 each year. And half of these babies die within the first 4 weeks of life. But the real tragedy here is that most of these deaths are in fact quite preventable with simple, cost-effective solutions that don't actually depend on highly trained providers or sophisticated equipment, but they do depend on innovative solutions and strengthening other parts of the ecosystem. So just one simple example is that the Indo-US Science and Technology Endowment Fund is actually currently supporting an innovative project that's looking at a low-cost device to resuscitate newborn babies. But once this device is developed, it then needs to pass regulations, it needs to be brought to market, it needs to be available to the user after negotiating what is often a long and tricky supply chain. And the point that I'm making here is that this is an intersectoral issue. This is not just a health issue. So if this argument only happens in the health forum, we're not going to solve these problems. So then let's look at the other end of the spectrum, as I'd mentioned. As these babies grow into women, they're at risk for developing cancer and other diseases, and they often have inadequate access to healthcare. Here again, often simple solutions, such as early detection of some of these diseases, can be implemented along with the help of cutting-edge technology, as Elena had mentioned. You know, whether that's telemedicine or deep machine learning of images, you can address this. And in fact, our National Institutes of Health has funded several grants that focus on affordable technology for the detection and treatment of disease. But again, just having these devices is not enough. You know, you really need input from multiple sectors in order to get them to the market and to be used in order to actually improve health. So then let's move to the broader question of gender equality overall. At the 2017 G20, which perhaps you were at, the US noted that women in both developing and developed countries represent tremendous promise for economic growth and prosperity. By investing in women around the world, we're investing in families, we're investing in prosperity, and we're investing in peace. So recognizing that health and human economic prosperity are connected, certainly the United States supported an intersectoral initiative called Healthy Women, Healthy Economies. Again, going back to your point, Wolf. More recently, here in 2017, November, the US partnered with India to launch the Global Entrepreneurship Summit, GES, with a focus particularly on women's entrepreneurship. And again, I'd like to point out here that there is considerable inequality as women climb in leadership, especially in the science and technology sectors. So let me, look at my own department before looking elsewhere. And one of our premier biomedical agencies, the National Institutes of Health, starts with approximately 50% of postdocs being women. But by the time you get to senior tenured scientists, that's about a fifth. Why is this? We should be looking at these barriers and addressing them, not only the US or India, but really globally. So in sum, bringing all of these different threads together, our goal should be larger than just women's health or child mortality. It should be to save, protect, empower women throughout their lives. And this in turn will improve health, improve economic productivity and gains, and thus accelerate sustainable development. So thank you again, and I look forward to the discussion.
Thank you, Preetha. Our last speaker is Dr. Frank Gray-Hanley, and he is going to speak about what are the best ways to share knowledge and promote cooperation to fight communicable diseases in the G20, and what will be the role of research networks. This is particularly of interest to me within the G20 to address emerging issues such as the AIDS.
Thank you so much. Thank you. I'm going to have to ask forbearance from everyone here for two things. One is I'm a living example of infectious diseases. I caught a norovirus yesterday and I'm dealing with it today. So I apologize for my voice and if I have to pause to sneeze. I'll try not to infect anyone else. And secondly, I want to speak a little bit from a different perspective than the others, I think, and that is because I work for the U.S. National Institutes of Health, and I manage a very large international program of research collaboration and a very large partnership. Part of that partnership is here with India and with all of the other countries that are in the G20. So I'm going to speak a little more concretely about specific programs and how specific programs and activities contribute to global knowledge, address infectious disease, prepare the globe for the problems that we face and will face in the future, and then try to kind of talk a little bit about what the global universe, what the horizon might have in it, and what the universe is like of tools that we have to address these problems. First, I want to just put everything a little bit in perspective. Yes, Ebola was a terrible event. We learned a lot from it. It has stirred up a lot of the Americans and Europeans, but it only killed about 11,000 people. There are 40 million people living with HIV/AIDS in the world today, and there are almost 2 million new cases of HIV every year. It is a pandemic that is underway, and it continues. 100 years ago, almost exactly 100 years ago this month, there was an outbreak, a global outbreak that lasted for about 23 months of avian influenza. It affected 500 million people, and it killed between 50 and 100 million people during the period that it was raging for those 23 months across the globe. That is more individuals than were killed in both World War I and World War II combined, and it was about 5% of the global population. So although we're stirred up about Ebola, I just hope that we don't forget that these problems, infectious diseases, will always be running ahead of us. And they will always be a new one. We know it will come. What we don't know is when, where, or exactly what that disease will be, or how virulent it will be, how fast it spreads, and what the impact is on our societies and our economies. We know there will be an impact, either a small one like Ebola, or a massive one like influenza. And of course, the ones that scientists that we're most worried about is a new strain of influenza, and trying very hard to develop a universal influenza vaccine that will protect us from whatever happens to that bug. Anyway, let me talk a little bit then about the questions that were asked, because I think some of the what we have available to us answers the question about what are the best ways to share knowledge and promote cooperation. So there are three ways that I know that knowledge is shared efficiently. Well, four. One, through publication, and of course scientists and public health experts and even a few policy people rely on publications to make decisions in policy and to treat and manage both public health and clinical disease. In my world, collaborative research is a really important way to convey information. These are grants and contracts, rather mundane, but when you bring on scientists and public health experts from multiple countries, there's a transfer of knowledge and wisdom and intelligence and creativity that really cannot be replaced by solely domestic research. Evidence shows that international teams are more productive than solely domestic teams, that what they publish is more actively used by other scientists, and it's of higher quality. In addition, over the last decade or so, we've been exploring with our colleagues in India, Brazil, South Africa, China, and a number of other places, a whole new scheme of jointly funding research. And what that does is it capacitates the research funding and administration capability within a country like India so that it can argue for more money from its own government by learning how to efficiently manage and do peer review and all of those sorts of mundane things. And for us, it's equally beneficial because it provides a partner with creativity and with access to populations and with scientists that are very well trained. We've explored that. It's turned out to be a really remarkable way of transferring not only basic scientific knowledge or discoveries, but also knowledge about the all-important management of research and facilitation of research growth. And of course, it's paid off, as you see, in many of the BRICS countries and in the G7, a wide and rapid expansion of their research endeavor, even though their budgets are under stress, which we're very encouraged by. There's also a whole array of training and scientific exchange programs that are invisible to most of the world. They fly under the radar, but I would undoubtedly guess that many of you in the room have taken advantage of such programs. Those seed knowledge and concern and set up careers for individuals who worry about communicable diseases and are there to be prepared. If we don't have in place a robust system of surveillance of disease and early discovery, of information and knowledge derivation about prevention, and then the development of medical countermeasures, so drugs and vaccines, then we have no hope of confronting these infectious diseases. Fortunately, I think countries, not only the G7, but around the world, particularly the G7, are now focused on that. And not only countries, but we also have a very rapidly changed now environment where over the last decade or 15 years, the private sector stepped up in a way they never have. Now, some of the pharmaceutical companies have stepped back, but organizations like the Global Fund for HIV, TB, and Malaria, the Bill and Melinda Gates Foundation, the Wellcome Trust, there's a whole array of these, have stepped forward with new funding, with new priorities targeting these communicable diseases, and with new priorities to target the development of research capacity around the world. So the NIH isn't the only organization that's now funding scientists in multiple countries. Fortunately, we have the great advantage of being able to fund science anywhere in the world, but most national funding organizations, like none others, can really do that. So having these philanthropic organizations step forward has been a real plus. And in addition, there's been a whole array of non-governmental organizations that have been stood up recently, including most recently the Coalition for Epidemiologic Preparedness and Innovation, CEPI, which in its first year received $300 million in endowment. They're now putting together the program of how they'll manage that, and their goal is to invent new vaccines or to take vaccines that are on the shelf somewhere and run them through the very expensive clinical trials that'll make them available for you and me. Coordination and cooperation across networks, I'll just throw out a few examples. That involves the exchange of information, like the Transatlantic Task Force for Antimicrobial Resistance, which really coordinates understanding and programs among all the countries of Europe and the United States and Canada. or look at networks that are actual research networks. And the best example of that, and this will be my closing point, is that over the last 25 or 30 years, we and our partners, but most of the United States, has supported 5 HIV research networks. Those research networks produced with their international collaborators and their international sites as well as domestic sites in those networks, they're all over the world. They have worked for 25 or 30 years, and they have produced the evidence that has turned HIV from being a 100% death sentence in the mid-1980s to a chronic disease. They've discovered the way to prevent the transmission sexually or from mother to child. Those networks discovered the use of the validity and use of male circumcision and other interventions to prevent HIV acquisition. And most importantly, over these years, they have developed, tested, evaluated, and refined the drug treatment strategies that have been used to prolong life for all of the individuals, and then to set up programs like the PEPFAR program, which has been able to deliver, and other service delivery programs, that we've been able to deliver the knowledge derived from those international networks into service and save lives all over the world. So it's a remarkable story of scientific achievement based on an international platform that produced evidence that could only be found in an international partnership. And I think the lessons that we've learned from that, although we haven't solved the problem of HIV, we've still got to come up with a vaccine, I think, to get there. But the lessons that we've learned from that partnership between scientists, public health experts, and then policy people and development organizations and those who funded the care side of it is really a remarkable one and unique in history. So I think we can be very proud and ask the G20 to replicate that in relationship to other diseases that we're facing, and to not be diverted by other priorities and forget just how urgent infectious and communicable diseases are to the life and well-being of individuals in all of our societies.
Thank you, Frank. In fact, one thing about having large collaborations internationally is also the power of replications. And in research, particularly health research, because the context matters so much to the outcomes that you find, the results, the evidence that you find, replicating it widely in new settings is actually a much needed improvement on existing evidence that we have.
Well, there are also population differences. So
Right,
you
absolutely.
really have to try,
Yeah.
you really have to explore interventions in multiple settings.
Absolutely.
And then, of course, there's all the things that others have talked about. Once you have those discoveries and that evidence, how do you get them into the population? And that's where you get into health systems and equality and all of the other more policy issues and service delivery issues.
Right. So that leaves us now with about 10 minutes for Q&A. Please identify yourself, keep your question to one, and identify the person on the panel that you're addressing to.
Hello, ma'am. I'm Babu from Bangladesh. Two things, I have actually two questions, sorry for that. First one is that when you talk about the G20 and if you see some diseases like thalassemia and others, I worked with thalassemia and I worked in Bangladesh, so the number of the carrier that is very high in each and every district. If you see in India, there's millions of patients are dying each year because of thalassemia. And there's other chronic diseases which are not in that much on surveillance. But if you see other countries like USA and others, they have overcome this issue. So is there any collaborative project where these diseases, when the US and other countries of G20 members have the experience to prevent this, and they can share with the countries who are struggling with this? And some diseases like Ebola, they're reviving. Like Ebola have revived after so many years. So this rare disease surveillance network, is it been established, or is there any plan of G20 to establish it? But second question is little bit different. That's the effect of climate change that is coming in the front line, and G20 countries, they owns the most of the economy of the world, frankly speaking. So if you see that there is really any study that what's its impact on ecology, especially marine life, and some or dolphins effect and others. But if you see that these water sharing and other things, or because of climate change melting, this some viruses are coming and these effects are coming. But at the end of the day, the people who are living in the bank of the rivers, their poverty and other things because of the flood or lack of water, that's correlating with their health, life expectancy and everything. Rarely I have seen any sort of a study which worked on this. That's all. Thank you.
Okay, let's accumulate a few questions and then wait. Yes.
Thank you for this opportunity. Almost all of you have spoken of a multi-sectoral approach to health. So a whole of society approach is something in various forms I'm hearing. But on the other hand, on the ground and even this in panel, if I take the issue of antimicrobial resistance, it is not just human consumption of antimicrobials. It is veterinary, it is agriculture, but I don't see anybody around. If it is so important, we need to. So the whole, I think one of the major G20 agenda has to be bring convergence among sectors, not disciplines, but sectors. And as I heard, Wolf, that the uncommon agendas can be brought together, negotiations can occur because of the political keenness, and I think I would like some answers on that. On the other hand, I think in India we have an extremely exciting example, Swachh Bharat. It is Clean India campaign. When we talk about Clean India, this money is not counted as in health, but major transformation will occur, its impact will be on health. So, and which clearly is an example that unless multi-sectoral interventions are done and keeping health at the center, you don't start seeing the impact, whether it is economies or even, I would say, even defense and security is linked with health. So I would like the panelists to comment on this issue, how to bring sectors or how to keep the lens of health at the center of a lot of sectors. Thank you.
Anna?
Yeah, the gentleman actually asked an amazing question, made an amazing point of multi-sector, and I'd like to elaborate on that, taking the example of tuberculosis. Now, India, our Prime Minister says that we would like to eradicate tuberculosis by 2025, and globally everyone knows that that's almost impossible. But what I'd like to know is where can G20 come into this point that gentleman has made about multi-sectoral, because for disease like tuberculosis, it's not just providing the medicine for it. I mean, it's an airborne disease. It's an airborne disease, and you know that with increasing urban poverty, with in about next 15 years, 65% of India would be living in urban areas with cramped conditions. I mean, this is basically going back in time to 100 years ago. So I don't think medicine would be a solution. It has to be multi-sectorial. So I would like your opinion where G20 can come in for diseases that already have a cure, like tuberculosis already has a cure, and yet we find it impossible to eradicate it. Thank you.
This white one. My name is Sunita Singh. I'm from Attache, India. The comment is directed to everyone on the panel, but particularly Wolf and Andreas, I guess. And several people have raised the fact that, finally at the end of the day, the G20 is about global public goods. And, both pollution, radiation, and many other, radiation as a pollutant, are important examples of the kind of things the G20 needs to take cognizance of, particularly in respect of its of the effects on health. I would argue that knowledge is a very important global public goods that needs to be considered as value that the G20 brings to, of course, its member countries, but I would argue for the world. And the extent to which this knowledge can be shared as a resource from the G20 or between the G20 and between other countries in the world would be an extremely important consideration.
So maybe we'll take one more and then Raji will come to you in the second round.
Hi, my name is Nikita. I'm a master's student in economic development. My question is directed to Mr. Gary, and I would like to know where G20 would factor in when it comes to modifying the international intellectual property regime in making medication affordable to the developing world. Thank you.
We have collected 5 questions. Let the panelists respond and then we'll have a second round. So, Andreas, would you like to start?
Yeah, for the easy question. That's all right. Let me just be very clear. I mean, I think I never said that G20 would replace traditional architecture, that G20 would not replace also existing very efficient networks in dealing with HIV or AIDS and other existing public-private networks in really doing an amazing job. The question is, the G20 usually comes in when there is a crisis, and that's why I quoted the Ebola crisis, which was the first crisis since the existing of the G20 on leaders level, or the G20 comes in when there is an economic question linked to it. And there are many countries around the in the G20 who think the G20 should only focus on core economic issue. So it's already a success to bringing parts, and I really say parts of the health agenda to the G20, to the attention of the G20 leaders level. So let's not make the mistake to think that the G20 with the leaders and all the power will solve all the health-related issues, which were all in the field of infectious diseases, in the field of child mortality. And there are issues which the G20 may be aware of, may include 1 or 2 lines in the declaration and encourage other people's, other networks to deal with it. But it's not the G20 who will suddenly solve an issue we've been all struggling for 20, 25 years with. I very much, I think on the question how to bring sectors in, I think it's a long shot. In particular, we have been trying on the antimicrobial resistance to really focus not only on the human part but also on the agriculture part. And not all countries around the table are very much in favor that the G20 is dealing with the agriculture part. So, but it's an issue which we all need to be very mindful and to continue pushing for it. Last point on the knowledge issue, and in particular I want to give you the example on antimicrobial resistance. I was referring to a new model of innovation. The German presidency is about to create a global innovation hub for antimicrobial resistance, which is, again, it's not replacing existing structure, it's just an addition. I think it's a very important one. It's also one which goes in the direction that you have asked. Where is the affordable medicine in this and the access to medicine in this context, which is a very complicated question. But I stop here.
Thank you. Wolf, would you like to answer the questions that were targeted to you? Thank you.
Yeah, as Andreas already said, very easy questions to answer. My impression is, let's put it that way. There are experts here on the panel better equipped to respond actually how to directly address some of the question. From an abstract level, I see that there is the hope and the wish that the G20 can be the cure, or that it can solve many challenges and problems that need a solution very soon, or at least new attempts. But I also warn, and this pretty much goes into the same direction as Andreas has said. So if we talk, you talked about the multi-sector approaches. We have knowledge sharing, intersectoriality, urbanization. So there are many wishes that go to the G20, and my point is a little bit similar to Andreas. It's the G20, and that was also one of the arguments of my intervention in the beginning, is that as it is set up, it is not in the position, and also in institutional terms, from my point of view, to actually address all these issues. I mean, we see that it's already gone a long way if you focus only on financial and economic parts, and the agenda gets bigger and bigger. And I wouldn't be surprised to see the G20 over the longer or midterm evolving into some kind of steering instrument that covers many, many aspects, and it also gets a higher degree of institutionalization. But currently, the G20 does not even have a secretariat. Yeah? We have whenever you look at networks or institution buildings, the building of institutions or establishment of institutions, they take over a longer time until they become fully fledged institutions. And I doubt whether the G20 is actually the right forum for some of the wishes which are here on the ground. One other point I would like to take up, and this also relates to what Grace said about the Ebola number of deaths and the other infectious diseases and problems we have. I think the perception of a disease is a very critical point. So, and this can change, and there maybe the G20 has an important role. It can change the perception of a global health challenge, on the one hand, and we shouldn't forget that the people who are sitting there at the G20, that their perception of an issue is also decisive. So it's important for research, for practitioners, to feed all the knowledge we have into or inform these leaders so that the perception is actually adequate.
Thank you, Wolf. Did either of you want to add, or Elena?
Sure. So first I'll go back to the antimicrobial resistance question. And I think that's actually a really good example of a problem that is now being looked at very multisectorally. And I think it's an important point that we're not looking at it only in humans anymore. We're also looking at, the so-called One Health approach, where you're looking at animals and agriculture and waste from production. But on the other hand, we're also funding new research into antimicrobial resistance. We're also looking at funding new innovative models, including CARB-X, which is a development hub for new antibiotics. And I think that's really good example of how you can take an issue and make it multi-sectoral, one that really goes across several different areas and using several different approaches. And that really answers your question about tuberculosis from one point, which is, yes, we know it's a problem. How do you use a forum such as G20 to help push this forward? And I think it's about putting it in language that makes it relevant, that makes it a problem, and looking at it across sectors in terms of how can we address this and what can different sectors bring into this. And just the idea of putting it in the spotlight itself is something that often moves something forward.
Because the G20 is an economic forum, it is the ideal place for the leaders of these 20 most powerful and richest countries in the world to come to understand that health, particularly communicable diseases, but I think also chronic diseases that are caused by lifestyle or that are related to that, are in fact economic problems. They're social and economic problems. And that was what was so encouraging about the German paper on this, is that it started out by recognizing that diseases are an economic problem, and that leaves it right in the G20. Now, that's not the place where programs get developed or those kinds of things happen, but it is a place where they can make a joint commitment to fund and to put more resources and to basically support from a policy point of view what is needed to address all of these problems. So TB is not going to be addressed as a scientific issue at the G20, but TB receiving funding in all of those countries that have high prevalence, like India, for additional research, for additional interventions, might have a benefit out of G20, so the more the merrier. And I would like to say that in TB, it's not just a delivery of care question. That is a big question, and that's a big question in a place like India. But it's also a fundamentally important research question that's been neglected for far too long. We need a vaccine we need more effective drugs, and we need to deal with multi-drug resistant tuberculosis, which is a huge and growing problem here in India. So it's not simply a delivery of care issue, although for many countries that is a big issue, and certainly India will be the first to tell you that that's a problem here. Climate change is being carefully studied. The impact of climate on diseases and on vectors in particular is being carefully studied, probably not as much as it should be, but it is being looked at by, for example, the National Institute of Environmental Health Sciences, the EPA, a number of environmental institutions really in Europe. Europe has led the way on a lot of that research. And I think more of it needs to move into the developing countries and to the BRICS and the mid-level countries, because that's where a lot of the problems showing up. So I think yes, more needs to be done, and I think maybe the G20 can help concentrate attention in the other G20 countries that aren't yet doing that work. And then rare diseases, finally. You know, there's so many new tools that are coming out. For a lot of the tropical diseases that are not funded very well around the world, you are 100% right. If you look at the G-Finder report, which is put out each year and looks at the most neglected diseases, it is appalling how little funding goes from most of the world into that. I mean, it's great that NIH funds about 60% of that work, but that should not be the case, right? It should be shared across the world. And the other thing to keep in mind is that we have this whole array of new tools. So for a lot of rare diseases are genetically based or host determined. We have all these new tools for genetic research, for genetic manipulation, for big data analysis. These new tools are just coming online, and I think we'll see in our lifetime these tools leading to more attention to some of these rare disease, and hopefully for the genetic ones, for some solutions.
Thank you. So maybe we will take the two questions. Yes, you and yes.
Dr. Tejwal Ahluwalia, former head of health system research in Indian Council of Medical Research and ex-CEO of Indian Yoga Association. Now India is a country of 1.3 billion people, and treatment of non-communicable disease is very cost intensive, and which is in the future is going to be unaffordable for the common masses of the country, because the out-of-pocket expenditure is roughly ranging from 70 to 80%. So my question is, do the G20 has got a roadmap of health systems research for the prevention of non-communicable diseases, especially the cancer, which is very cost intensive? And what is the timeline for midterm evaluation of the G20 research agenda and mid-course correction later on? Thank you.
Rajiv?
Rajiv Mantri from India. So my question is on, so one of the major challenges in global health today is the rising cost of drugs. And related to the rising cost of developing drugs is the regulatory pathway to commercialization. Partly caused by the different standards across different countries in the Western world, which are pioneers in developing these standards. So I don't expect that the whole world would converge on one standard, but can we bring commonality in the clinical development process, which might help in lowering the cost of developing new medicines?
Oh, sorry. Please.
Thank you very much. It's a great conversation. My name is Robin Gorner, and I am one of the global co-leads for the She Decides movement, and very much enjoyed talking about gender policy and politics earlier today with a fairly remarkable group of people, including your Sherpa from OECD. In a former life, I led some of the negotiations for the UK around the G8 on the HIV agenda during 2005, and we were really proud about what could be achieved through the G8, and I think the points are very well made by our US colleagues on that. And I see the G20 as having a very particular role on health as we move forward and we move the centre of gravity of power in our international negotiations. At the G20 last year, the W20, the Women's 20, brought some of the issues around rights and health to the foreground. And so you won't be surprised to hear me say that I think it would be an excellent opportunity to look at some of these issues of rights. Now, obviously, it's somewhat complex, but I think the issue of sexual rights, reproductive justice are fundamental, and there's a real opportunity for leadership here. And multi-sectoralism, multi-stakeholder, absolutely. We've also known that rights and health are connected for many decades. So here's an opportunity to drive that forward very much with an economic aspect as well. So my pitch, yes, diseases, but let's also think about sexual and reproductive health and the link to rights and to gender more broadly when thinking about the G20.
Thank you for that comment. Would any of the panelists, do we have time for one more question? Priyanka? Yes, please, go ahead.
So my question goes to Wolf. When we're talking of this multidisciplinarity in research and in program implementation, we, especially in the low and middle income countries, see that implementation is usually weak. And especially in the context of health, where it has to do much with other determinants of health, implementation of other programs. So the question that I have for you is, how do you see G20 or any other such global body taking up leadership role in health, working with the priorities set by other stakeholder constituencies? So what kind of alignment do you see for this?
Thank you. So we have that question and two on the drugs, one on affordability and the other is standardizing across the world for trials, etc. So would any of the panelists like to take a shot at that?
No one else will. I can't, the IPR question is a deep and difficult one. It's not one I'm qualified to answer. And I don't think it's an easy, there's no easy answer. You don't want to squelch innovation. You don't want to not reward discovery. You don't want people to take property that then discourages innovation and investigation. So but at the same time, you need to find ways to provide access to poor populations for drugs that are very important. I think maybe an illustrative example of that is what happened with HIV. Drugs were very expensive. They were eventually, pre-qualified for generic production and marketing in certain markets. And that, although seemed unfair in some ways, was globally justified and equitable in access for mainly Africans who needed access to those drugs. So, there are tools and there are ways that a lot of people are looking at that question and trying to resolve it where it comes up. But I do think we have to be careful not to react too far in the other direction because, the innovators will go away and then we're in trouble because governments will never be able to pick up all of that weight of the innovative discovery. The question about getting uniformity in drug trials and in definitions and in protocols is a really good one and really important now, and that's one of the big lessons out of Ebola, is that it would have helped so much if the research response to Ebola had been informed by local governments already having in place, DSMBs, ethics review, protocols that were, acceptable and were going to produce good results. And I think that WHO is, to its great credit, struggling now under the R&D blueprint to try and come up with some of these tools and mechanisms that would help make it easier in the future. Obviously, you can never one size will never fit all because it's so different if you're doing a vaccine clinical trial phase 3 or, but yes, there's a lot of that could be consolidated. And I'll also say on behalf of a sister agency, the Food and Drug Administration, that I know they're working very hard globally to try and harmonize some of the regulatory matters that relate to drugs. I think that's impossible. I think it will be very hard to do that. But I'm kind of skeptical, and my friends at FDA say they might get there. And certainly progress has been made.
So I'm just going to add a little bit on the access to medicines questions, particularly, just because it is such an important one. And I want to point out that there are trickier things to deal with, such as the intellectual property aspect of it, because there's such variance in how people deal with this. However, there's many more commonalities actually than differences if you look at access to medicine as a larger issue, whether that's looking at supply chain models, whether that's looking at different models of licensing, such as voluntary licensing or medical patent pools. So just wanted to say that this is really a much broader issue than it's generally presented, and this is one that will probably be discussed at the World Health Assembly, so certainly one to keep an eye on.
Please, Elena, continue.
Thank you so much. I want to refer to two very important comments on ensuring that women's sexual and reproductive rights are included in the programs, and the programs on, for instance, cancer prevention, that they require some evaluation. So referring to the main topic of our roundtable is framing the health agenda for the G20. It's really critical that we have, of course, somehow stated right now the state of art, what is really important in this, in our opinion. But in terms of the format, it will be great that we have academic programs like the one that were mentioned that has all these multidisciplinary or inter-country working groups, but it's also important to ensure that we have practical solutions to the problems identified, also being the part of the, let's say, framing the health agenda. And in these programs we know that we have good M&D component, and we know that these programs are working, and we know that it's not only the principle of women's rights being ensured, but the programs that already have these implemented in various formats. So that will be great to have both, I would say, both angles, so academic and practical solutions.
Yes, thank you. Four very quick points. First, on the question G8, G20, what has been achieved? I think the G8 had a track record of almost 20 years of dealing with health issues. That's why we had big successes on the Global Fund for malaria, for AIDS, malaria and tuberculosis. We had successes supporting the eradication of polio. There were many things which were really through a continuous process in this G format, supporting other areas, other networks, which led to the successes we could have observed. Let's face it, the G20, as I told you, has just started 2.5, 3 years ago dealing with health issues, and also in a not so overarching issues. And I have a lot of sympathy of what has been said to think about when we discuss also about the gender dimension, about the reproductive medicine and stuff like that. These are all parts of the same medal, but I think the G20, to be very frank, is not yet there to deal with all health issues in this complexity what we have seen before. But as said, there is certainly room to maneuver. Second, on this question of non-communicable diseases, what can the G20 do? I think it's really an important question. It's a question which came to the agenda of the G20 only now, this year, a bit last year already. So again, we are very much at the start. I think, as I said before, the G20 has a function in communicating about things, in warning about things, in giving impetus for other fora, in giving impetus for providing resources that all countries agree that there is an issue. Give you an example. We had one of the best-selling books we have at the OECD is a book we launched 3 years ago called Fit, Not Fat. So just because of you brand the thing that it's better to be fit than fat, you have an issue that many countries started then using these publications, using the policy recommendation to develop programs which may cost something, but which are at least the G20 has a role to provide the advice. The second point you mentioned is of equal importance. I think we still need to do a better job, and this goes across the board to all the G20 policy issues, to monitor the things. And that's why one of the reasons why international organizations are sitting around the table. And it's really very important, in particular in the field of health, that we monitor the commitment of the leaders and we see what each and every country has been doing over the years, because only with that we can make it count on a global scale. And you mentioned within the intervention, it's about implementation, especially in the health agenda. Very last point on your point on the stakeholder consultation. There is a lot going on in the G20. There is now a business 20, a labor 20, a think tank 20, a science 20. Maybe at one moment in time we will have a gender women 20. We already have a women 20, which is very important. But at one moment in time we may also need a health 20 for the dialogue with the Attache. Thank you very much. Sorry for being long.
Yeah, I think Andreas has already answered my question to some extent, and thank you for that. I also like to thank you all on this occasion for the stimulating food for thought. It's very a pleasure to get that and take that with me. The different T20, B20, W20 context is also what I would have mentioned. It's in place. It can be strengthened. I should say that as a representative of the German Development Institute who co-chaired the T20 process during the German presidency, there's still room to expand that. I think another point for alignment or new agenda setting is also this rotating presidency, which is an opportunity for each country to bring in own ideas and additional elements, if possible, and accepted by the others, of course. Finally, also a little bit with regard to the emerging economies and the role, a little bit in the particular problems they have. There are many things or many thoughts I have in mind which particularly important for emerging economies in the global health context, and I think we all agree that they are indispensable, decisive to addressing all these issues. For the time being, also seeing that we run out of time, I would just stress one of the points that Gray has mentioned before with this, the ability to cooperate, collaborate internationally, I think is very important. Not only on this applied field, but also in to get the thinking a little bit around, and this does not apply only to emerging economies, but also you look into the public health education in Germany or so, the global health dimension is to get that into the minds of the people in the curricula and so on is really important. And I hijack this point also a little bit to do some advertisement for the Managing Global Governance program that our institution is running it together with a large network of partners from emerging economies, which engage collectively in capacity development.
Thank you all. I think I'll wrap it up by basically making one broad observation that, globally every country is faced today with higher health costs. This is, of course, it varies a great deal by the way you manage, the nature of the governance, the financing mechanisms. It is true, affordability when it comes to drugs is very much a concern, particularly when it comes to the poorer countries. And yet, innovation really is the way to move forward. But there are several drugs, and this is making a case for the generic markets and how a country like India has been able to provide cheap drugs to a very large size population globally because of the market principles and the broad objectives that the country has followed. So this forum, while it is new and you can tell that it really is a work in progress, we're sort of developing a narrative around the role for G20, for healthcare in particular. It's an evolving discussion. But thank you all for your inputs. We have learned a great deal, and I will now take it to the organizers. Thank you.
Thank you so much, everyone. On behalf of ORF, I'd like to thank all the panelists and everyone here.